Medical debt was the number one cause for the bankruptcy, and you had 48 million people who couldn't get insurance. 48 million people who couldn't get insurance because the Uniteds, the Humanas, the Blue Crosses of the world said, nope, you got some pre-existing condition. All right, so I think it's time to, I guess, rewind the clock, especially with the climate at hand, where we are just coming out of a government shutdown, a lot of it having to do with the fact that after this year, subsidies for the Affordable Care Act plans, right, the quote unquote Obamacare plans, are expiring. And a lot of it is because they gave tax breaks to millionaires and billionaires, and they figure, hey, we need to cut somewhere. This would be the first place we cut, right? As a physician, I think it's crazy. And I think a lot of people really missed the mark on how significant the Affordable Care Act plan has been since its inception. So I want to bring us down to memory lane this episode so people can kind of understand why the fight was the fight and why it still needs to continue. Like, I know, especially this month, I think they're going to be, I guess, reconvening to have conversations again to see if they are willing to push the extension for a year or so, right? So I know that's probably happening around the time of this episode dropping. So I do want to give people and get people back in that scenario, right? Because, and I see this all the time when we talk about vaccines, right? So you have vaccine detractors who will tell you, oh my God, before vaccines, what did people do? Yeah, they died early. They died early, right? And because of vaccine and because people aren't dying early and you're living such a good life, you don't even remember a time where people weren't dying early, right? Unless you are an anti-vaxxer now who loses their children because they got the measles. Then you recognize what that is, right? Again, and what I love, right, and like I said, I hate to go in the soapbox, what I love is that when you have these measles outbreak and when you have children who pass away from the measles outbreak, the anti-vaxxers are awfully silent. All of a sudden, they are not in my comments. They are not in none of our comment sections fighting to be anti-vax, right, when children die. So that's the scenario that typically occurs when we think about, oh, like, what was it like before they got vaccines? Yeah, people died early. So when I think about the healthcare conversation and the Affordable Care Act conversation, it's because I know a lot of people do not remember what it was like before the Affordable Care Act plan. So today we are going to talk about it. So before we get into, the nitty-gritty of the conversation, I want y'all just to think out loud or just drop it in the comments. How many people in this country do you think were uninsured prior to the Affordable Care Act plan? Right. I want you guys to just think about this. Right. 2009, 2010. How many people were uninsured prior to the Affordable Care Act plan coming into fruition? Right. I want you to just think about whatever you think that number is. I'm going to pause for a second to let you kind of marinate. 48 million. In the comments, let me know if 48 million is the guess that you had. Like, let me know if you were like, well, maybe, because I'm pretty sure a couple of you were like, I don't know, maybe a couple of million, 2 million, 3 million. 48 million people were uninsured, right? And not even talking about the underinsured, different conversation, but just uninsured before the Affordable Care Act plans. So you can kind of understand just how significant the law was when it got enacted, right? 48 million people were sitting here uninsured. 48 million people were one medical emergency away from absolute catastrophe because they were uninsured. Like, that is the backdrop scenario. So just so people can kind of understand what used to occur before the Affordable Care Act plan, insurance denials. And you may be saying, Dr. Barry Pierre, like, what do you mean insurance denials? You had insurance companies, these same insurance companies, the Blue Crosses, the Uniteds, Humanas of the world, who routinely would deny people to get on their plans. So out of those 48 million people, you might have had a good amount of people who were trying to get on the plan. So that 48 million people doesn't mean that they were uninsured and they were just walking around like it was nobody's business. No, they were actually trying to get insured, and you had systematic, automated ways for people to deny them left and right. Right? You have asthma, denial. You have diabetes. Now, mind you, a lot of these things you typically have to be in the system to get diagnosed. So imagine a scenario where you are in the healthcare system. Let's say you got insurance with your job. Okay, this is a perfect example. You got insurance with your job, let's say with Blue Cross, with United, right? Because I know people talk about United a lot. You get diagnosed with hypertension, diabetes, high cholesterol. You lose that job, or you leave that job for another job. And you say, hey, United, I was just under your plan, with my work. I want to go ahead and just get my own insurance. I'm stepping out. I'm going to be an entrepreneur, whatever the reason is. I'm changing jobs. And United would be like, oh, yeah, that's interesting, Mr. Pierre, but you have hypertension, diabetes, and high cholesterol. So we're not going to insure you. Sorry. And you ask yourself, yeah, I know I have these things because you guys help diagnose these things. And they're like, yeah, we understand we help diagnose them, but now we're going to use them as a reason to say why you can't be on our plan. This is what was happening across the board. Pregnancy, anemia, obesity, denial. So again, just so we can make sure let's jog back to 2008, 2009 when you were trying to get insurance. This is a reason why so many people get kicked out. Affordable Care Act plan made that thing illegal, thankfully. If you are young, once you turn 19, you got booted off of your parents' insurance because the insurance companies are like, hey, man, they're about to turn adult. I don't want to have to pay for any adult-related health things. Boot them off the plan. So you can be in high school, turn 19, and they're like, oh, you're 19 now? Get up out of here. You're off our plans. Sorry. Right? So your parents could still be in good standing. Imagine your parents are in good standing with the insurance company. They're paying their premium every month. Paying the premium every month. Oh, your kid's 19 now? Oh, they got to get their own plan. Oh, and we diagnosed them with asthma when they were young? Yeah, they're not going to be on our plan. Again, I wish this was hyperbole. I wish this was like dream scenario. No, this is what the reality is that I know a lot of people have forgotten, conveniently, because we've had such a great time having a law that says you cannot do that. Women used to pay more just for being women. Hey, you're a woman, which means you're likely going to see us more because women tend to see their doctors more. They tend to use their services more. Hey, being a woman, add a little tax on there. Here you go. Here's your woman tax. This was a reality. Bankruptcy over bills. Medical debt was the number one cause for bankruptcy. Medical debt was the number one cause for the bankruptcy, and you have 48 million people who couldn't get insurance. 48 million people who couldn't get insurance because the Uniteds, the Humanas, the Blue Crosses of the world said, nope, you got some pre-existing condition. Could you imagine if they do this now? We just went through a pandemic. Imagine a diagnosis of being diagnosed with COVID being a reason why you can't get on some insurance plan. How many people had COVID? And I'm not talking about the COVID that you have lingering issues. And no, I was diagnosed with COVID. I was hospitalized. They find that because they will find it. They get information like, oh, no, you're diagnosed with COVID in 2023. So, yeah, we're not going to insure you because that's a pre-existing condition and we don't have to take that burden. Right? Like, this is just the reality that it is, right? And I'm not even talking about the fact that they used to have limits on how much they would pay. So you're in the plan. Let's say you get cancer, right? Let's say you're on United, you get cancer. And they say, oh, you know what? You're about to meet your max. Like we only, put enough to pay, $500,000 on you for your entire, lifespan here. You've hit that. We're kicking you off the plan. this is the reality, y'all. Right? Like, so again, I want to make sure I'm painting the scenario correctly, because a lot of people are sitting here acting like the Affordable Care Act plan has not saved millions of lives. No hyperbole, millions of lives have been saved. And, we can get all business. Like, a lot of those uninsured people still went to the ER. And then guess what? When they got that bill, hey, I can't pay this bill, right? You go eat that. So now you had hospital systems that would hurt, because guess what? I'm taking care of so many uninsured patients. I have no way to get paid from them. Guess what the Affordable Care Act plan did? It made it away. So now I'm seeing less uninsured. I'm seeing more insured. Guess what? I'm getting paid more. Right. So again, as a hospital system, as a doctor, as a clinic, now all of a sudden there was more income because you were seeing more insured patients. But that wasn't the case prior to the Affordable Care Act plan, because all of these people would not have insurance, and they were going to, flood the system, which is from the ER room. And this is where a lot of the animosity of ER rooms being filled came from, was because so many, like, you guys think that ERs are busy now. Guess what it used to be like when 48 million people in this country were uninsured? Just to give you an idea, it was busier. So I want folks to kind of understand and get that when we talk about this onus of, what is a world like without the Affordable Care Act plan? And when you hear your politicians act like, oh, you know what, we could just let these subsidies go, we'll replace it some way, right? And you're like, hold on. In the meanwhile, while you're trying to work on replacing it, what are you guys going to do? Because remember, it's not the priority. It is not the priority to make sure you guys have good health care. The priority was to make sure the millionaires and billionaires got their tax cuts, and they made them permanent. So imagine, they fought, right? This administration fought not to only keep the government closed, that those who had SNAP benefits had to go eat on food banks, because they would say, you know what, I'm going to stop their SNAP benefits so I can try to force the Democrats to open up the government, because I don't want to extend healthcare subsidies to the same people who are going to vote for me, right? Again, it's mind-boggling. It's mind-boggling to me that you have people who had to stand in lines at food banks because the same administration went to court to block their distribution of their funds to their SNAP accounts, because they did not want to extend healthcare subsidies, which isn't like free healthcare. It just means that, hey, you know what? It's going to be a discount. Like, it's still going to be some money. You're still going to have to pay money for your premium, but we're going to offset some of that cost, because you had some people seeing double, triple their premium costs for the next year, right? And this is the reality now. People are getting letters now, because it's open enrollment. People are getting letters now saying, hey, your premium costs are going to be double, triple. And guess what? If you don't get those healthcare subsidies, this is the new price. So if healthcare premiums were already at the top line of their bills, all of a sudden now they've doubled or tripled it. What do you think a person's going to do? They're not going to get it, right? They're going to say, hey, you know what? I can't afford that, so I'm not going to do it. And I will deal with the consequences, which those may not know. There's actually consequences for not dealing with it, right? For not having health insurance, is actually some issues, right? Like on taxes that you have to deal with. So this is a scenario that I want people to walk down, right? Like when you hear the conversation of people stressing how important it is to not only keep the Affordable Care Act plan, but to also get these subsidies back, this is the reason why. Because they understand there is a world out there where people are going to walk around uninsured because they can't afford to be on their health care plan. They just can't afford to pay month to month to month for their healthcare plan based off those rates, right? That is the reality that a lot of people are having to face, like, as we speak. So, like, again, I don't want to say I don't like to get political, because I love getting political, right? Because for my patients, I need to be aware, and this is a significant issue. And now, again, when they have pushed the country to the brink to say, hey, you know what? We are willing to shut this country down. We're willing to make sure people go hungry so that we can afford to give millionaires and billionaires tax breaks. But you, the person who needs to be on the Affordable Care Act plan, you got to figure out where to get that money from. I got a problem with it. Right? I got a problem with it, right? And your healthcare provider should also have the same type of problem, right? And if they don't, you might want to have some questions with that healthcare provider or find a different one. Not suggesting you find a different one, but like it, for me, I would be very concerned if my healthcare provider didn't care if I could actually afford the healthcare premium that pays them. Because if I can't afford the healthcare premium that pays them, guess what I'm going to do? I'm not going to go to them, and then their money should go down, right? But again, it's neither here or there, right? So again, just to make sure we understand what these healthcare Affordable Care Act plans did, right? Remember, no more pre-existing condition denials, right? Like, and this, I love this number. 54 million people in this country have some type of pre-existing condition that would have precluded them from being insured. 54 million of them, right? Heart disease, cancer, pregnancy, denied. These insurance companies, it's a dirty game right here when we talk about insurance companies, right? Young adults covered to the age of 26, mental health benefits, maternity care, covered, right? All of these were covered. And what I hear a lot, right, especially from those who are uninformed, of, oh my God, it's not great in my state. Now, one of the things that people don't recognize is that depending on the state you're in will depend on whether you get certain benefits or not. I'm in the state of Florida, who made it a point to say, hey, you know what? Because with the Affordable Care Act plan, there is additional dollars that each state can get to help, push down the costs. We don't want that. Right. And why do they do that? So they can now push the cost to their consumer, aka their Florida resident or their whatever state resident. They push the cost to them and say, hey, look how costly this plan is. Because they know that that person doesn't understand that, hey, yeah, but if you would have just accepted those benefits, it wouldn't have cost me that much. Right? Like, these are just all of the games that were being played, that continue to being played, especially when it comes to politics and our healthcare, right? So you have a person who say, oh my God, the Affordable Care Plan is very expensive, very expensive. Yeah, it's very expensive because one, your state likely is making sure that it's very expensive. So you can look like, oh my God, look how expensive it is. I hate it, right? Like that because they, unfortunately, some of these politicians played a long game and they recognize that, like, okay, if I make them take the extra cost, right, they'll blame the Affordable Care Act plan and they won't blame us, even though they should, right? So yeah, it's a crazy world that we're living in right now. And again, just understand that if you, right, have healthcare, right, if you are an Affordable Care Act plan and you've seen your premiums go up, you need to be very active with your congressman, whoever your local congressman, stateman is, or congresswoman is, to say, hey, what are you doing to make sure my premiums don't go up 2x, 3x, 4x? What are you doing about that? Because I can tell you, the insurance plans they got are great. They don't got to worry about these problems. They don't have to worry about Affordable Care Act problems because they got government insurance. So for them, they're cool with it. They're cool if you paying extra. It's not going to affect them, especially because you'll just blame the Affordable Care Act plan. You won't blame them. They bank on that level of misinformation. Thankfully, you follow a channel like mine who's able to kind of shine a light where misinformation and disinformation can be hiding in the bushes. Right? So I'm again very excited that again this month they will be having the conversation on trying to extend the subsidies. Just depending on when this episode drops, because it should drop in December. Because like obviously I pre-recorded. Understand that you have to be very vocal. You have to be very active in your healthcare plan because so many of you guys that I take care of, so many of you guys that are in the community recognize that again, one bad medical bill could be extremely detrimental to your family, and one expense that doubles or triples from December to January could be life-threatening, right? And that's not hyperbole. life-threatening, because guess what? You don't see the doctor, you miss that regular routine appointment, that would have checked your labs, that would have made sure you get your colonoscopy. All of a sudden it misses some type of cancer diagnosis that you don't catch till it's too late. And this is because you have politics playing games with you, who are willing to look out for those who are very, very privileged, aka millionaires and billionaires, and not look out for the majority of the 48 million people who used to be uninsured. And it'll be much higher, if this goes into effect, where all of a sudden people can't even afford to be on the plans. Very scary times, but again, you watch this channel, you follow me, hopefully make sure you subscribe, to keep you up to date on things. And like I said, I will be dropping an update, whenever that vote goes down. I'll be dropping an update to let y'all know what the skinny is and how to move forward for 2026. See you guys next week.